Hi, this is Mr. Williamson, and this is Torso Prep Quiz number 2. Hopefully you've watched the first 2 videos, the discussion on the torso, and part 1 and part 2. This is able to prepare you for the upcoming test, and get you ready. Probably should have a piece of paper so you can write down your answers rather than trying to remember them. Remember, you can pause the quiz anytime, the video anytime you want, and stop it, so that you can take your time to think about your answers. I'm going to continue a little quicker than you probably can answer, but just pause the video. So here we go. Okay, the first question is, what is this, or this chamber right there? What is the name of the chamber, and what does it do? So we're talking about this chamber that's right in here. Name of the chamber, and what does it do? Or where does the blood go? I guess the best question about these would be, where does the blood come from, and where does the blood go from that chamber? So what's the name of the chamber? Where does the blood come from? Where does the blood go? Give you just a second, and we're going to move on. All right. Next question. What is the name of this chamber? And where does the blood come from, and where does the blood go? Name of the chamber, where does the blood come from, where does the blood go? All right. What is the name of this chamber, and where does the blood come from, and where does the blood go? Name of the chamber, where does the blood come from, where does the blood go? All right, and then name of this chamber. Where does the blood come from? Where does the blood go? All right. All right. The question is, on that last chamber, this chamber right here, is it high on oxygen or low on oxygen? Obviously, hopefully you can read the title, but put it up there so you can kind of remember. Is it high on oxygen or low on oxygen in that chamber? All right. Is this chamber over here high in carbon dioxide, or is it low in carbon dioxide? All right, the next question. Is this chamber here, this one down here, is that high in carbon dioxide or low in carbon dioxide? Think about where the blood's coming from, where it's going. That might help you. But you know, is that high in carbon dioxide or low in carbon dioxide? Next question. Is this chamber here, this one right here, high in oxygen or low in oxygen? Again, think about where it's coming from, where it's going, and see if you can figure it out. High in oxygen or low in oxygen? All right. Although we've kind of already asked this question, this chamber right up here, where does the blood come from? And, a subsequent answer, question, where does it go? So again, with all these, you need to kind of think, where does this blood come from and where does it go? All right, so on this blood vessel, where does that blood vessel go? Okay, and then what is the name of it? The other thing you might want to think about is where does it, is it the blood in it high in oxygen, low in oxygen, high in carbon dioxide, or low in carbon dioxide? It's not a real question, but if you can answer those, you're doing really well. Okay, so let's take a look at the answers. First one, what is this and what does it do? This is the left ventricle, my bad. Left ventricle. And you can tell it's the left ventricle because it's got a really thick wall, it's a thick muscular wall. It's because the blood, the muscle has to contract, squeezing all the blood here out of the heart through the aorta up this way and back to the body. So it's really, really a strong muscle, a really thick wall. This is going to be high in oxygen. It's going to be low in carbon dioxide, right? And one of the things that can help you remember the atrium ventricle is that it's alphabetical. The atriums are on the top, A, before V, ventricle, right? And remember, the heart is reversed because you're looking at it from the person's front. So the person's here, there's his head, there's his arm, and his two legs are down here. And his right side is, left side is over here, and his right side is over here. So we're looking at the left ventricle. Okay. The next one was, what is this chamber and where does it go? Where does the blood come from? Where does it go? This is the right atrium, and the blood is coming from the body, and it's going to go down into the right ventricle. Okay, and it's going to be low in oxygen, all right, and it's going to be high in carbon dioxide. And the reason you can think about this is, one of the things that will help is when you see a blood vessel that is blue, it is a vein. All right, veins are low in oxygen, and they are high in carbon dioxide. And there are a couple exceptions to that, but you don't need to worry about that for this. But there are a couple exceptions. All veins go to the heart. They go to the heart. These over here, these are arteries. Artery. There we go. Okay, they are going to the body, and they're red. They're red because they are high in oxygen, and they're low in carbon dioxide. Think of blood. When blood is, you cut yourself and the blood comes up on your skin, it's red. It's really a red color because the oxygen in the atmosphere is being absorbed by the hemoglobin in the blood, turning your blood red. If you saw blood that was in the veins, it would be kind of a darker red, almost bluish color. So, and that's the way to think about it. Red is arteries, and they're going from the heart to the body. Blue is veins, and they're going from the body to the heart, and they are low in oxygen. So anytime you see blue, think that it's going to the heart. Okay, and it's an artery, vein. Excuse me. This is the right ventricle, and you can see it's a little thinner wall. Doesn't need to be quite as strong because it's going to pump it out here. This is one of those exceptions that all arteries are high in oxygen. This is actually still low in oxygen, but it's going to the lungs, and so it's coming from the body, going through the right atrium into the right ventricle. This is like the receiving chamber, and this is the chamber that's going to pump it out and go to the lungs. So the right ventricle, and it's going to be an O2, it's going to be low, and in carbon dioxide it's going to be high because hasn't been in the lungs yet. So, and the final chamber that we talked about was the left atrium. I just put it over here, probably better for you. And it's just this chamber here, and it's bringing the blood from the lungs into the pulmonary vein, and it's going to be, because it just got back from the lungs, it's going to be really high in O2. It's just picked up all that oxygen out of the atmosphere. It's going to be low in carbon dioxide because it got rid of it. And it goes into the left ventricle. From the left ventricle, it's pumped out the aorta to the body. So anything on the left is going to the body from the lungs. Anything on the right is going from the body to the lungs. But it's, again, a receiving chamber before it gets to the ventricles. High in oxygen or low in oxygen? Well, there's a hint. I gave you a hint earlier. If you're looking at it, these are red. These two arteries right here are red, and it happens to be high in oxygen because it's coming from the lungs. Red blood that is coming from the lungs has oxygen, is red. So they've shown everything as being red here. And this is the left atrium. It's going to go to the left ventricle, and then it's going to be pumped out the aorta. Sorry about that. All right. Next question was this chamber here. High in carbon dioxide, low in carbon dioxide? Well, the thing to take a look at is, again, this is blue. This vein is blue. And so the blood coming in here is going to be high in carbon dioxide. My bad, not thinking here today. High in carbon dioxide. This is the right atrium, and it's taking the blood from the body and taking it into the right atrium. So it is going to be very high in carbon dioxide because the body has used the oxygen and let go of the carbon dioxide that's being used or produced by the respiration, the Krebs cycle. Is this one high on carbon dioxide, low on carbon dioxide? Well, this is the blood. This is the left ventricle. Okay. So it's going to be pumping blood to the body. Well, the body needs oxygenated blood, and it's going to go through this red aorta here. So it's going to be really low in carbon dioxide because it just came from the lungs and passed into the left atrium through the left ventricle, and it's gotten rid of all the carbon dioxide in the lungs. It's gotten rid of the carbon dioxide and it's picked up the oxygen. So blood that's here is going to be low in carbon dioxide and high in oxygen. Again, think about what's going the system. The lung is picking up the oxygen and getting rid of the carbon dioxide, and then it's going to be pumped out to the body. Well, the body needs that oxygen, so it's going to be low in carbon dioxide. Think about the system. Think about the flow of blood and what's going to happen at each step. This is the right ventricle. It is going to be low in oxygen because the blood's coming from the body through into the right atrium, into the right ventricle, through this blue vessel. Blue vessels are veins, meaning that they are low in oxygen and high in carbon dioxide. So that, again, this is going to be very low in oxygen. Where's the blood come from? We kind of answered this before, but take a look. You've got these two pulmonary arteries, and they are coming from the lungs. All right, and it's going to be going to the left ventricle. But the answer to the question is it's coming from the lungs. It is the left atrium. And again, it's the receiving chamber. It's kind of where the blood goes to be deposited or kind of received and pre-staged before it goes down into the major pumping chamber of the heart, the left ventricle. So it's coming from the lungs. This is the vena cava. Okay, it's blue. Okay, and it's where does it go? It's going into the right atrium. All right, it's coming from the body. It's going to be low in oxygen, and it's going to be high in carbon dioxide. But it's called the vena cava, and it's going into the right atrium. And that's it. Hopefully you did well on that quiz. If you kind of could follow along and anticipate the questions, then you probably know the circulatory system fairly well, and that's a good thing. If you didn't quite do as well, I encourage you to go to take a look at taxonomy prep, the torso discussion video number 2. It's primarily on the circulatory system. Take a look at it, see if you can follow it along. Take a look at your packet. Make sure you ask questions in class. Hopefully you're studying for the test. See you on test day. Good luck.